Hello, my name is Tulsi Panchal, and today I will be presenting on dissociative identity disorder, which for short I will be calling DID. What is dissociative identity disorder? DID, also known as MPD, multiple personality disorder, or split personality disorder, is a psychiatric disorder characterized by a recurrent activation of two or more distinct dissociative identity states that we call alters. It also is signified by episodes of dissociative amnesia, which means that the person forgets what they do in one of their other alters, and other various dissociative symptoms. Approximately 1.5% of all the population is diagnosed with this, and about 6% of psychiatric outpatients have this. But many people go undiagnosed because some people might have symptoms that are not very visible, or they might be misdiagnosed by their psychiatrics, but like they might be diagnosed with another disorder when they have this one. So, how it comes about? Usually, DID comes about because of severe childhood trauma and abuse. Most of the DID patients have PTSD too, and you would rarely find DID patients who have not had a past of trauma. Older models used to suggest that DID came about by suggestibility, cognitive distortions, and fantasy, but those were further studied and discarded because DID usually comes about because of trauma in the past. Obviously, cognitive suggestions do play a role in it, but it would not come about just because someone is fantasizing that they want to have another personality. Okay, so the differences in brain structures. People with DID usually have a significant reduction in gray matter volume, which also makes them have a reduction in all these other um, structures that I said. And they also show predominant activation in parietal regions, insula, and the limbic prefrontal circuitry, which makes these like important structures in the study of brain and DID and that. They also show a significant reduction in cortical thickness and surface area when compared to people who do not have DID. The roles of neurotransmitters in DID. Well, the one that comes to light by studies is dysfunction in N-methyl D-aspartate. This is a neurotransmitter. This is a receptor of glutamate, and as we all know, glutamate is a primary excitatory neurotransmitter in our brain. This plays an important role in the pathopsychology of dissociative states. Therefore, an MDA agonist could be used to limit the level of dissociation. Because of the shade thrown to people with DID and the misdiagnosed cases and all of the questionings, because we don't really have good ways to diagnose this thing, many people have a lot of questions about it. And it has been thrown under the bus a lot of times by psychologists and psychiatrists. That's why it was very difficult to find all this information on the internet or on our school library or wherever we go, because you have to look a lot to find whatever we're looking for. So it kind of worked. a bit for this presentation. Thank you.